I'd like to welcome everyone to a Yale Peace Lab and Aurora Humanitarian Initiative podcast. Real stories, real impact, real lessons from those changing the world in different conflict zones. The mission for the podcast is to elevate the Aurora Prize heroes and humanitarian leaders through evidence-informed storytelling from Yale Peace Lab, humanizes crises, reveals practical solutions, and inspires action even in fragile contexts. So welcome to the Heroes of Aurora, a partnership. I am the host today. My name is Lindsay Millicarrick, and I am representing Physician Associates for Global Health. Today we are hosting Dr. Jacqueline Gautier, a humanitarian leader whose work has transformed lives in Haiti. In places where context disrupts everything, health systems, families, futures, Dr. Gautier has helped to build the solutions that work. Beyond the headlines and statistics, we'll hear the real challenge and problem on the road, what evidence and experience teaches us, the human stories that drive this work, practical steps anyone can learn from. As per our host, Dr. Gautier, please feel free to raise your hand and ask questions throughout the session today. We don't need to save all of our questions for the end. This is Heroes of Humanity. Let's begin. So thank you so much, Dr. Gautier, for joining us today. I'm just going to start with the first question. You spent 30 years transforming St. Damien Hospital from an AIDS and HIV hospice into a major 200-bed referral hospital. Looking back, what was the most critical turning point in making that vision a reality?
Thank you, Lindsay. It's a pleasure to be here. Thank you for having me. And, healthcare has always been more than a profession to me. It's a commitment to the belief that every child deserves a chance to live and to thrive. So I'm grateful for this opportunity to share with you part of my journey into this. And I invite the audience to participate with us. So turning points about transforming an hospice to a hospital. The very first turning point, I should say, is the decision of the founder, a Catholic priest, Richard Fréchette, to open that hospice. Because originally it came under the auspices of the organization Nuestros Pequeños Hermanos, our little brothers and sisters, No Petit Frère et Sœur, to open an orphanage. And he was so moved by seeing sick and dying children at cramped rooms in a home for missionaries of charity downtown Port-au-Prince. This is the order of Mother Teresa. And those children were dying. It was on the beginning of the AIDS pandemics. The children were terminally ill and they were dying. So he decided to open a few rooms from the newly acquired building, a former hotel, in the middle of a wealthy neighborhood in Pétionville. He decided to open a few rooms to put cribs to help those children die in dignity. When he was there to mainly open an orphanage for that organization that was founded 20 or some years before in Mexico for street children and orphans. So that was the first turning point. So he's the founder of that hospital. And many people consider me and among other people as co-founders. So the second turning point was when I decided to leave my private practice to join him. So I came to work with this organization called by a friend, pediatrician, and we each has our own private practice. And it was kind of a side gig to help alleviate the suffering of those dying children. And after 2 years or so, going twice a week, I saw that the priest was particularly serious about healthcare because at times he would let us, my friend and myself, transfer those children to real hospitals, private, and the organization would pay for all the expenses. So one day I told him, Father Eric, if you want me to leave my private practice, I can organize a hospital with you. He hesitated. I was a bit puzzled and disappointed. And later he agreed. The rest is history, and we're going to talk about the rest. But he told me that he had in mind to open a hospital, actually, but he had a different strategy. He wanted to attract foreign, semi-retired or retired pediatricians or doctors. But at the end, I'm happy that he accepted that I joined. So rapidly, I built a small team of 4 physicians. And then fast forward 20 years later, we were 78 physicians, different specialties, pediatrician, the bulk of it, but also obstetricians, and of course, countless nurses and other pharmacists, etc. So that's the main 2 turning points at the beginning. There would come many more with strong partners join us. And I consider each one as marking their own turning point. And also they were local and international. I am saluting, for instance, a dermatologist who has offered a free care from the beginning to until now to the children. And from Boise, Idaho to 15 pediatric hospitals in the US and in Canada, to strong partners, some of them are with me in Italy. So that's the history of the hospital, the main 2 turning points.
That's amazing. Haiti has faced severe overlapping humanitarian and security crises. How were you and your medical teams able to manage to maintain high quality patient care and operational morale during periods of extreme insecurity?
Interesting question. So I left in 23, and I'm sure if the current leader, executive director is online, I had invited him, he can give an update after. So first of all, we invested a lot in social leadership. I mean, you have to have a special mind, not a special mind. You have to have a dedicated mind to embrace such a difficult cause and to be facing mountains behind mountains. We have a good saying in Haiti, Deyemon Gemon, literally after a mountain, another mountain. So you have to have a special mind. And so we invested in social leadership, not only competence and hardcore leadership skills, but also what they call soft, but that should be really widespread, like inner awareness to understand yourself, to work well with others, and compassion and empathy. So we encourage that, and we try to do that from the time we recruit people. We try to recruit people like-minded. So, and also our mission has been provide quality care with compassion. So that also has helped. So we rooted our work into empathy, even though we cared about hardcore leadership skills.
Absolutely. In your recent work with MSF Belgium Academy in Sierra Leone, you focused heavily on clinical training. What is the biggest gap in pediatric training globally right now, and how can international partners fix it?
Well, it will not be just the work of the international partner to fix it, right, Lindsay? But we all can contribute to fix this. So it's simple. There are too many children for too few providers trained in pediatrics. So in Sierra Leone or for the little I've seen in West Africa, you have huge regional hospitals, so-called regional hospitals, about 300 to 500 beds hospital, with half are occupied by children and only 1 pediatrician, if any. Of course, generalists can develop on-the-task knowledge, pediatric knowledge, but it's not sufficient. So there will not be one-size-fits-all solution for this. You cannot jump on thinking that you're going to train enough pediatricians to cover the whole population of the world. It's not realistic. So you have to combine many things. Of course, at the top of the pyramid, pediatricians and subspecialists in pediatrics, right, to address specific problems. But you can also rely on the way Physicians Without Borders was doing in Sierra Leone on clinical officers. And so you adapt to the country's reality. In Sierra Leone, they had a good school of clinical officers with 3 years training. So after they get a preliminary general training, we, MSF, Doctors Without Borders, hired them to work at that pediatric hospital and benefiting from 2 years training in pediatrics while working. Of course, at each department, there was what they call an international medical mobile staff, IMS, mentoring them. So I was responsible for classroom studies as well as bedside mentoring. So that's a solution that fit well the reality of Sierra Leone. But you could use also family practitioners. It's actually a very good resource. And at the bottom of the pyramid, you can also provide special training to nurses or very seasoned health agents in pediatrics, and using also algorithms and using new technology like electronic tablet, so they can really get to the diagnosis and they have access to the drugs, appropriate drugs. So, so we need to really solve that gap, adapting to the reality of the countries.
And as a physician associate, thank you for, shouting out our profession in other parts of the world. I'm really glad that you had a good experience with the clinical officers. And, hopefully we can continue to address the disparity in the lack of healthcare workforce that, really leads to some of these deficits around the world.
Definitely, Lindsay. Yeah. Your specialty, your profession is really valuable and needed.
Yeah, thank you. And I'm really glad that you got a chance to work with them and see that on the ground.
Yeah.
As an expert in global immunization and infectious disease, what are the primary cultural and logistic barriers you face when trying to deploy vaccines in under-resourced communities?
Well, I'm currently the chairperson of what we call in Haiti, Groupe Technique de Vaccination, the Consultation de Vaccination, which is an independent volunteer group providing recommendation to the Ministry of Health. Each country has that committee. And so I think that, and then other people in the audience will agree with me, that in countries like Haiti, we don't have a huge problem of acceptance. And let me go back to another saying. In Haiti, we have so many nice proverbs. In Haiti, proverbs are sayings. In Haiti, people say, after God, the doctors. Après bon Dieu, c'est docteur. So luckily, we don't have a huge problem with acceptance. However, with COVID, we've seen a little bit of confusion created throughout the world because it was an unknown disease and there was a lot of fears, and the vaccine was kind of pushed to people. So we have a lot to learn about how we really develop new products to the population. And remember that for some reason, some still studied reasons, that unknown reasons, that our population were not that affected compared to North America or Europe, for many reasons that we have not really mastered well. So people were confused, and I think that has really spilled over a little bit of a problem of acceptance, of hesitation. But besides that, I would say that we don't have a problem of acceptance. So our problems are more logistical. And luckily, WHO, UNICEF, and Gavi are working hard to really fill the gap of logistics. We're talking about cold chain. So it's really when I'm old enough to remember kerosene refrigerators that were really hard to maintain. It was really hard to maintain the correct temperature. Now we are using solar refrigerators, and we're using a lot of devices also to monitor the correct temperature, because vaccine has to be maintained really strict temperature.
Okay.
And so the logistics, we have support. However, because the US has withdrawn from many of those organizations, so funding is really diminishing, and it's unfortunate, because when you have disruption of services, specifically in places where the costs are climbing because of insecurity, because of problem with transportation, and you have disruption, that can create confusion. So at some time you have a lot of intense activities, at other times you have less. People may think it's not that important. With this child, people were really looking after the vaccination. Now I don't see. So this is really an unfortunate negative impact of those reduced funding. And it's too bad, because until now, we have to recognize that vaccines are the best tool developed by healthcare, right? Think about eradication of diseases like smallpox. Think about the diminution of diseases, almost eradication of neonatal tetanus. Think about Haiti. I want to shout out to Haiti. We haven't seen any measles case. Listen to this, Lindsay, since 2001. And I want to really that the audience really clap for us. At the time, we're in the US, in Canada, in many countries in Latin America and Europe, you have, because of hesitation, of confusion about that vaccine creating wrongly confusion, autism, you have a lot of, but Haiti, since 2001, I haven't seen one case of measles, at a point that the experienced pediatrician, we fear if that disease is imported, that the young pediatricians and other doctors will not be recognizing it early enough. It's so contagious. And right now, my group has made a recommendation to the Ministry of Health to conduct a campaign to cover the diminished coverage due to the insecurity, to avoid any importation. So to go back to your, I hope I did not go too long to answer that story. So we have made a lot of progress. It's really up to us to continue. We have good vaccine, but we need them to reach every child.
Mm-hmm. Your quality control and continued funding to continue to support and sustain are still super important moving forward. Absolutely.
Indeed.
I'm glad that you don't have to battle acceptance as well as another barrier on that pathway.
Well, pending that also we do good communication.
Right.
Because another reason for poor acceptance would be the management of the adverse effect that are 99% of the time benign. But if I'm a young mother, I bring my really happy and jumping baby, and I get back home with a child with a fever, and I'm not aware that it might be. So good management, good communication, good governance of the expanded program of immunization are needed also to keep it that way.
Absolutely. You have transitioned into a strategic advisor and fundraising role. What is the hardest part about communicating the urgency of local health crises to international donors who are miles away?
Oh, I'm transformed to many things, including right now working on antibiotic resistance, but we can talk about that a bit later. And so, yeah, if you're not, it feels harder if you're away and if you are far to understand the problems that as a donor you're trying to solve by contributing. So it feels hard. The urgency feels less with you. And then fundraiser cannot also organize open house activities. So contributors, old or new, can really see for themselves what they are contributing to, right? So it's hard. But seasoned fundraisers, fortunately, we have many around, they have an area of strategies, right? And the goal is really to get donors to be recurring donors, right? And to cultivate small and major donors, because you need a mix of them all to cover your needs. So fortunately, there are ways you can also organize online activity. COVID has been a blessing in that way, teaching us how we can really take advantage of online activities to get to keep the connections of donors to the beneficiaries and to the institution, to the implementers if they cannot really travel. You can also get the leaders and the implementers to travel and meet the donors and speak and advocate. So there are a lot of strategies. But I want to say something, and I want to say two things contradictory. The first one would be that, and I've been happy to work in philanthropy. What I didn't say about turning points before joining, sorry, I have not closed my phone. Yeah. So I wanted to say two things to get back to the line of thought about philanthropy. The first one is that I've been happy to work in philanthropy of my life, and I will likely continue, right? I see what philanthropy can do, good philanthropy can do. But philanthropy will not solve the problems of countries like Haiti or Africa or Southeast Asia, right? We are filling a gap. And if you go to a place, there is an abundance of philanthropists, that means something is wrong. Something is wrong with local governance. So us philanthropists, we have to really understand that and engage in good coordination to avoid waste, to avoid a lot of bad things about philanthropy. The second thing that may seem contradictory is that we are one world, right? So there is let's compare that to one human body. So the hand cannot be healthy when the head is sick, right? And also we have to remember that most of the countries suffering right now have provided wealth to so-called first world countries through slavery or exploitation of our resources. So it feels like right for philanthropists to honor that reality.
Absolutely. Throughout your career, you have worked extensively in maternal and child health. What structural challenge are most urgently needed to lower infant mortality rates in developing countries?
We could devote 2 or 3 or 4 hours or days, right, on that topic. But let's try to be concise. We should start with the mothers before to get to the infants. That means maternal care has to be strong, right? Prenatal care has to be a reality. So that means working on the communities for young mothers to realize that they need, because they seem healthy. If I can be pregnant, I'm healthy, I'm young, but I need vaccination. I need to prevent complications. And I need to stay alive. So if that child becomes orphan, who's going to take care of that child? She's going to get malnourished. She's going to die, right? First, good maternal care. And it's a hard one because maternity, delivery of the children at hospital is a really major problem for our countries. So we're talking about preventing complication, eclampsia, hemorrhage, providing blood, providing transportation. If we have prenatal clinic at a remote place, if that mother develop a problem, she has to get to the hospital, right? And then there we take the child. We know the killers actually of children in our countries. We know the pneumonia, we need oxygen, we need antibiotics. We know about diarrhea, good rehydration. We also know about many other common diseases that can kill the children because we don't have emergency care. We don't have intensive care. So we know the killers and we know we know what to do. We know the structures that are needed. So we have to work on that. And back to vaccination, we have to prevent the diseases instead of really spending money and energy to cure them, and sometimes the children die.
Mhm.
And we should not forget between the mothers and those under 5, where we have to focus our attention, the newborn, where actually the mortality is higher. And we're talking about possibility to resuscitate the newborn. Will utilize the 1 minute golden time to help that baby breathe, to resuscitate. And so all of these are needed really to decrease the infant mortality.
Mhm. And I'm sure that also comes back to public education and making sure young mothers know what kind of complications can arise and sometimes when the hospital, is necessary for births, for deliveries, and making sure that they understand that just as a public education. Yes.
Definitely working on the health determinants.
Hmm.
In fact, a lot of time we in healthcare, you would agree with me, we intervene to solve problems that should have been solved by having really people employed, people eating well, people literacy, right?
Yes,
Etc.
primary prevention. Yes,
For
absolutely.
instance, keeping the girls at school
Hmm.
to help them delay pregnancies. A lot of things that are needed.
Hmm. Absolutely. Yeah. After decades on the front lines of global health, what keeps you optimistic about the future of pediatric medicine in regions that need it most?
Hmm. Well, in my lifetime, I've seen progress. So that keeps me optimistic.
Mhm.
And that helps me also when talking to younger physicians or pediatricians or nurses to share my experience. When I was doing my residency training in Port-au-Prince, we always had a room at the main referral hospital in the capital full of neonatal tetanus cases. Think about that. 80 to 90% of those children would go dying after a lot of suffering.
Mm.
Guess what? Now, almost no neonatal tetanus. It's a victory of vaccines, right? And I can remember Hospital Albert Schweitzer was, or I put my first foot in philanthropy in the center of the country. A wonderful hospital founded 70 years ago by Dr. Larimer Mellon from Pittsburgh. There, in the early 80s, they had already found the best way to prevent neonatal tetanus, which is the vaccine in prenatal care. So at that same moment, we still had a lot of cases in Port-au-Prince. So, but now in the whole country, it's really much less. So that's one thing. The measles, I told you before, and many other things. And also I see advanced pediatrics in Haiti now. We were doing general pediatrics. Now we are at the point we are doing subspecialties, oncology in pediatrics. Actually, Hospital Bassaja is the only place where they provide oncologic care, and also neonatal screening for sickle cell, and many valuable, also put available pediatric surgery, which is subspecialty. We not only were having teams coming to operate on kids, we train surgeons to become pediatric surgeons. So all those progresses made me optimistic. But I must say right now, seeing the country's situation with the gangs taking over, that my optimism suffer.
Mhm.
I want to keep it though. I would finish by saying that us Haitians, we are confident people because of our history. So I'd say personally, my optimism is rooted in my history.
Mhm.
You know that we are the first free country in the world. Do you know that, Lindsay?
No.
Okay. So I used to say we are the first Black republic free in the world. Now I'm saying, period, we are the first free country. So we gained our independence in 1804 to 20 some years ago, right?
Mhm.
And we were the first free, I repeat, free, because you did, as an American, the US had gained its independence in 1776, but you still had slaves. So you are not free because your population was not completely free, right? So we are the first free country in the world. And we did so by defeating the biggest army in the world, which is Napoleon army. So that gives us confidence that we can regain that. We can, like as phoenix, resuscitate from our ashes. And so that's another reason for optimism,
Mhm.
even though, as I just said, my optimism is suffering these days.
Mhm. And how do you try to work through that on a daily basis when you have those moments where you're feeling, just a little bit more defeated because you were there through all of this progress and all of these amazing, milestones and this growth and development, and to have a little bit of a setback. I'm just wondering if you have any words of wisdom for dealing with those moments where you feel a little defeated, but you have to keep going somehow.
I think that the families looking for help are also so resilient.
Mhm.
And this is inspiring. For instance, when I left Hospital Saint-Damien since 2023, until then, and I'm sure it continues, we had families braving the unsafe streets, braving going out from their neighborhoods was already a miracle. Really, I mean, it was really wonderful to see the families. Okay, that child is sick. I need to brave. So we that inspired them and encouraged them to be ready because we promised to get the healthcare accessible. We have to deliver,
Mhm.
right? And also the sense of team building. But I must say that the hardest was the kidnappings.
Mhm.
Before I left, 4 staff members were kidnapped, not at the hospital, for ransom. So think
Mhm.
about the stress for their family and for their colleagues.
Mhm.
And we even lost, unfortunately, a physician who worked with us for
Mhm.
20 years because she resisted a kidnapping attempt. This is haunting us until now to see
Mhm.
how you can really lose your life
Mhm.
in these circumstances.
Yes, lots of sacrifice. Absolutely.
Yes, yeah, but the resilience of the family kind of drives our own resilience too.
You keep going for that sense of like altruism, just like we're all trying and working together to make this keep
We
going.
made a promise, we engaged, we committed, nobody forced us,
Yes,
right?
exactly.
So
Yeah.
this is the kind of work that we want to do, and we have to be there.
Yes. Just for
We
everyone.
made a commitment.
Yes. Absolutely. One last question before we get to some questions in general. You've spoken about the world needing a critical mass of kind people to overcome violence and indifference. Aurora brings together more than 100 humanitarians who embody exactly that. What does it mean to you to be part of a community that feels like the critical mass of kindness you described?
Yeah, it feels good to belong to a network of kind people. But I can add to kindness what we also need these days for leaders. We need a lot of awareness, self-awareness, right? Because that will prevent a lot of problems we see. You don't have to belong in philanthropy to understand awareness, inner awareness, what's good for me is good for my colleagues, and it's good for people. It's good for to avoid cruelty that we
Mhm.
see developing in front of our eyes, that the Haitian community is suffering from in many other countries, right? To diminish exploitation. So we need that awareness on top of the kindness. And so it's really Aurora connection, the question about how does it feel to belong to Aurora. I've seen, it's really beautiful that Aurora could transform the Armenian tragedy into humanitarian action. And I'm really appreciative of the strengthening of their efforts to put us together because collectively we can do a lot. We can make the world a better place. We're talking about people working in dire circumstances against women violence against women, war, civil wars, against injustice in the world. And so when we get together, it's inspiring to learn from each other, to share our experience. And I have experienced that firsthand just last year at a summit that Aurora organized in University of California in Los Angeles, where we met all together, all of us, luminaries, right? And also other leaders from international organizations to learn about opportunities, etc. It's feel really, I appreciate that.
Mm-hmm. Feels good to be part of something bigger. Absolutely.
Collective humanitarianism.
Yeah, absolutely. Well, thank you so much. You answered all of our questions. Now let's see if the audience has any questions for you. Please feel free to drop your questions in the chat. We can steal Dr. Gautier's a few more minutes of her time to answer some of these questions. Don't see anything coming in yet.
Feel free to raise your hand as well, and we can make you a host, and we can have you speak as well.
All right. The first one from Mary. What role does social media have in your work to increase awareness?
More and more war, because increase awareness, it can be collective and also it's a direct way to communicate with families, beneficiaries, right? WhatsApp is widely used. As soon as there is a smartphone, you can have WhatsApp. And it's really wonderful. I think that from when I started to work as a physician to now, when there was no cell phone available, so you could not do recall. We do not recall. You could not help people remember the appointments when the child has a chronic disease. So social media is wonderful. And I think we can use it better. I'm glad about that question. I think in immunization, we can use it better about good communication to keep acceptance. And yes, I think it's, so we have started to use it and we should more and more. And actually, one thing I've not covered about different things to diminish the gaps of care, telemedicine. It's not social media, it's using technology. Telemedicine is a really wonderful way. And I'm currently involved voluntarily with MSF to provide telehealth medicine in many countries, in Afghanistan and in Africa, in Creole or, no, not in Creole, in English or in French. Sorry.
Another question from Aman. Any advice for the younger generation in your country? Any inspiring stories to share?
Oh, stories. There are a lot of stories. So many. Let me try to think. So from the beneficiaries and also from the staff, thinking about filling the gap of the shortage of competent staff. I remember we talk about training, but we should also talk about retention. Retention. People have the right to look for better life, right? To move from rural to urban areas and to abroad. It's a right? But there are also ways to retain them. And I remember once at Saint-Ami at the beginning, before we had a new hospital, we were still at that hotel, transformed into hospital. We ran into a problem of low wages, and the nurses wanted a raise. And so I entered some discussion with them. And they said, Dr. Gautier, you need to give us more money, first of all. But you know why we are going to to wait and be patient, because I asked them for patience for a few months because I needed to convince so many stakeholders, too many actually, right? They say, we like to work, we're not going to go on a strike because we have the structure, we have the medication, we have the lab. We're not working just for the money, we work to make a difference. And you provide the infrastructure and the setting and the drugs and the lab, so we're going to be patient. So like it's maybe not a really great story, but to me, I always remember that. So retention is not just nice nice rewards or compensation. It's also good infrastructure, good good mentoring support, good supervision, right? And stories about when I stopped my car to a pharmacy in Port-au-Prince, and there was that woman selling foods, and I wanted to bargain, and she said, "No, take it for free. This child who is 9 years now, you saved her." And I could never remember that. You saved her from meningitis, and you explain what meningitis is. Take the food, doctor, go with the food. And of course, I did not go with the food. So there are so many other stories encouraging like that. I see are there other questions in the chat that we should look at?
Jennifer has says, as the chair of the National Immunization Technical Advisory Group of your country, what is needed to improve the communication flow with the Haitian Ministry of Health?
Thank you, Jennifer, for that question. We are working hard on this. It's a hard one. And so we tried what would be needed. It boils down to governance, because actually the Ministry of Health installed our committee, right? So they should be the first to encourage the communication instead of us, instead of the other way around. Having said that, we are working more and more together with them, even getting into operational part of the work, when originally we were there to make recommendation and not intervene in operationalization. So working a little bit side by side with them with operationalization will improve the communication. But it's a two-way thing, right? So we can do as much as we can, but this part has really moved toward us as well. But we're working hard for that.
We do have a few other questions. I know there is a live question. I think we're just seeing if we can get the live question ready for you.
I see a hand up.
Maybe I'll just read in another question real quick while we're getting that guest ready to go. This is from Pascal. Congratulations, Dr. Gautier. Good intervention and very inspiring. You have a lot of experience in humanitarian settings in a country like us, Haiti, where one crisis follows another. For you, how can we keep healthcare going without always being in emergency mode?
Oh my goodness, Pascal. Congratulations for staying at your role. Is it Dr. Gasson?
Yes.
Yeah, thank you, Pascal, for attending and for participating. And you're a hero for keeping the boat, right? So I think you have what it takes to face this never-ending situation. Which keep the hope. Keep the hope. Think about our history. Think about the families depending on you, on the good work, and keep the hope. I am sorry I don't have. I wish I could just with a magic wand come and stop that banditism, right? But it's not possible. And specifically that we are thinking about election, that will be a very, very vulnerable time for the country. I think that get inspired by the population and continue to work and to provide that team building activities so people don't get discouraged, and take care of them and their souls, and engage more and more your support, international and local. And the local support is really wonderful. About stories, I can remember on the highest time of a shortage of fuel, we had a director of a fuel institution that called me to offer a good stock of gasoline that we use to run our generators, and we also use to share with our doctors, nurses. So those gallons of gasoline were really like gold, very expensive. And the head of that institution just called me to offer that huge stock. This is another story. So I'm sure you can still tap on the local volunteers and also vendors to help you, and encourage. Keep up the good work.
An anonymous comment. Thank you for your hard work. Could AI ultimately make humanitarian work more human or risk distancing us from the people we are trying to serve?
Actually, let me give you another story. Recently, I was chatting with a young mother, pregnant, whose mother has worked for me. And she's pregnant. And I was pleasantly surprised that she's checking on ChatGPT about what to do during the pregnancy. Isn't that wonderful, right? Currently in Haiti, she's due to deliver next month. And she said, well, so many people are advising me to do this, to do that with the baby, to do that, blah, 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 blah. I said, what do you do? Call me, chat with me. She said, well, I asked ChatGPT. So a smartphone is wonderful to take advantage of AI, right? Wherever you are in the world. And there are many other things that AI will help us do, right? Continue to do to achieve new, yeah, sure. But at the same time, we should be cautious. We know that AI is not without problems, right? All the water consumption that depriving, again, our own settings, from crucial resources. So yes, but.
Mhm. I think we have one live question. I know we got a couple more for you. Lots of good questions here. Just waiting for Amon for 1 second, see if we can get that live question.
I think, yeah, Johnny should be able to speak. Just unmute yourself and speak, Johnny.
I think Joan dropped off.
Oh,
Joan,
no.
I see a question for Marlene, good friend.
Yes, we do have one from Fabian as well. I'll get to it. I know it was asked before, but what can pediatricians in the US do to help their Haitian pediatric colleagues during this difficult time? And great presentation.
I mentioned a lot of strong partners, and from a Catholic hospital in Boise at the earliest time, and to a wonderful network actually of pediatricians. And I'm sure Dr. Gasson can tell us if they are still involved. Unfortunately, they cannot travel, and we cannot also send our bring our pediatrician to the US or to Europe to get bedside, really truly global, two ways global. So I think they can keep working with our Nos Petits Frères et Sœurs resources in the US to remain connected at a time then they cannot travel. And I know Marlene herself has worked has been a colleague from really Schweitzer time, my Schweitzer time before even Saint-Damien. And I know she has worked hard also with the American Academy of Pediatrics. I think she can encourage Academy of Pediatrics to strengthen their efforts, for instance, and study ways that are possible given the impossibility to travel. Mm-hmm. And I'm sure that the Saint-Damien network is still active with our fundraisers here.
And Fabian said, great presentation. She also said, if people want to reach out to you to hear more about your work, how can we do so?
Hi, hello.
Hello? Is John addressing that question for me? John?
Good
Well,
evening.
Fabian, thank you for that question. I can provide my email address, or through Aurora, they can join me, right? I'm not saying the Peace Lab, Lindsay, it would be a possibility, right?
Yes. Yeah, I can
So
put
the
that.
Peace Lab at Yale and to Aurora, but my email address is easy, is my name, jacqueline.gautiermd@gmail.com.
I'm gonna add that there in the chat.
I just wrote it.
And yeah, I think then Joan has a question. Oh,
Go ahead, Joan. Johnny?
Yeah, hi. Good evening. Can you hear me?
Yes.
yeah.
Hi, Dr. Jacqueline. It's really good to hear from you again. We last met at the GNN community in Morocco last year, and I'm joining today from Indonesia. I'm on study leave at the moment, and one of our colleagues who I went with at that GNN actually recommended that I attend tonight, and I'm really grateful that I actually did. I'll just get straight into this, the question I have. Um, thank you, Dr. Jacqueline. You spoke about the importance of international partnerships, but also about philanthropy filling a gap rather than becoming a substitute for local systems. In fragile or resource-constrained settings, how do we recognize when external support is genuinely strengthening local capacity versus unintentionally creating a system that becomes dependent on that support? Yeah.
Wow, thank you for being here, and thank you for that question. You know, I read recently an article shared by Colin from Aura that is so interesting, and I can toward I think toward Australia, which was really with you at the GNN meeting, send that it's really questioning that the good narratives that the philanthropists have to really entertain. It starts with what you say, you know, to really challenge those philanthropists about the real reasons motivating them to get involved. Because there are narratives that tell you, verb before action. And see also the way they are intervening. There should be some good coordination. Everybody cannot do everything on a country. Specifically, it's not your country. And I'm so glad that Father Fréchette, for instance, accepted that from the get-go, we had a local leadership for an institution. If the philanthropists want to really take the place of the local, it's not good philanthropy. The leadership to solve our countries has to be local. I cannot pretend now I'm living in the US that I want to change the country trajectory, right? They will not let me, actually. So first of all, we have really to challenge them to understand their commitment, how they come, and their narratives. And also see if they are ready to really collaborate to avoid waste, right? They don't want to do everything. They want to understand what's available and work in collaboration. Other than that, we've seen disastrous things after the earthquake in 2010 in Haiti, where we had a pouring of help and little achieve, and really little impact, positive impact. But I hope I addressed that question, but I think we could really devote some good times, and I'm sure that Aurora will really continue that type of conversation to make sure that what we do, waiting for the country's governance to be normal, right? It's really has a real impact.
Yeah, thank you so much, Dr. Jacqueline, and good to see you again. Thank you so much.
Hello, thank you for being in the audience. And I hope it's not a big time delay for you. It's not in the middle of the night. I don't know.
Not at all. It's almost 9 p.m. here. Thank you.
Okay.
I think we got them all. Let's see, all the questions, lots of thank you, fantastic presentation. So lots of people very appreciative.
I think one last is how do people get involved and with your and to help you?
Okay, currently the executive director and other people involved are there. And Tommy, you can reach them. I've actually left that hospital and I'm an independent advisor. And I do have a project that is really dear to my heart, which is resistance against antibiotics. And I'm trying hard to start that program in Haiti currently. So any help would be welcome. So briefly, widely used medication, antibiotics, is getting really inefficient because the germs are getting resistant. And we need to really counteract that. It's really one of the big threats against life these days. It's silent, it's deadly, but luckily it's completely preventable with good education of implementers, of clinicians on good utilization of antibiotic, strengthening lab, which is a very hard one and expensive, and also provide access to stronger antibiotics when it's really needed. So I would be happy that people contact me to help me launch that program in Haiti. To begin with one hospital, a pilot that we will expand to other hospitals. So the best way, I put my email address in the chat, and also Tommy, you can reach Nos Petits Frères et Sœurs Saint-Damien, not a hospice, but now a hospital. And so, yes, so thank you for asking that. And to Aurora, because Aurora is the really main driver of this today. And with Lindsay, I address how the humanitarian initiatives are really going with this.
Well, thank you so much, Dr. Jacqueline Gautier. We appreciate you so much for coming today and for sharing your leadership and humanity with us. Listeners learn more about Dr. Gautier's work and support Humanitarian Heroes at aurorahumanitarian.org. We'd also like to thank our other partners, Physician Associates for Global Health, Health Tech Without Borders, and On the Ground AI. Thank you all for joining us.
Thank you, Lisa, for your question, for your nice question, and thank you for to the audience, and thank you to Aurora.
And just one thing real quick, I forgot to mention, but our next session will be on October 13th at the same time with Dr. Mohammed Hariri, who will be discussing surgical emergencies and needs in Syria. Thank you.